Thank you, Professor. I'm John Michael Yingling from University of Oklahoma. How CurvaFix has been implemented in our region, we'll indicate it for curvilinear corridors where straight screws may be unsafe for placement, or during acute pelvis and acetabulum fractures where a load-sharing implant or immediate weight bearing may be beneficial, considering ipsilateral lower extremity injuries that may do better if your weight bearing is tolerated, or for low energy fragility fractures of the pelvis, sacrum, or acetabulum, where we'd be mitigating some of those stasis issues, almost like a hip fracture corollary, preventing people from getting blood clots or pneumonia or ulcers. Here's one of the cases we selected was JM. He was an 80-year-old male who presented to our facility for a periprosthetic right acetabulum fracture around hemiarthroplasty. And about 6 weeks prior, the family thinks, or maybe even a little bit longer, he had sustained a low-energy pelvic ring injury and was treated non-operatively and had been unable to get out of bed. He's been essentially bedbound since then. He attempted to get up this time and fell, and that's how he injured his right side. Before his fragility fracture of the pelvis, he had been able to ambulate with a rolling walker around his house independently. Here's an AP radiograph of his pelvis that we obtained. You can see on the left side he's got some callus formation around a pelvic ring injury and the right-sided acetabulum fracture. Here's a, how do I get that there? The CAT scan that was obtained, you can see on the left side, he's got in non-displaced impaction of his left-sided sacral ala and a pubic root fracture with some calcification there, and also this ischial ramus with the acetabulum fracture on the right. Some choice cuts of the acetabulum fracture, demonstrating more of an impacted, we eventually classified it as a associated both column acetabulum fracture and a Roman's 2B pelvic ring injury on his left side. So surgically, we elected to use a curved intramedullary implant for his left-sided posterior elements. Navigating around his prior, we believe he had a sacroplasty, wasn't able to recall when or why that occurred, and also this antegrade anterior column implant, and then applied lateral traction to his right side and placed a quadrilateral surface plate to prevent that femoral head from protruding, and then through his iliac tubercle down his gluteal pillar, used an intramedullary implant down his posterior column. One of the things that was interesting here is I think the plate, provided some sort of a blocking element, which made that passage of the wire a little bit easier and kind of prevented it from coming out the fracture, which can happen sometimes. Here's, so the reason we chose this was to help navigate his curvilinear corridors and then allow this elderly patient who's been bedbound for some time and deconditioned to allow him to get up and start weight bearing, hopefully help with pain control and help him start moving and get back in shape. Here's our final fluoroscopic images showing our AP inlet and outlet of the implant. Trauma team actually got a post-operative CT scan, which was serendipitous for us. It allows us to kind of nerd out and see how our intraosseous placement of our curved implants and following it down the posterior column there, as well as our anterior column, ensuring a safe passage here. So we'll thank them for that. These are just the coronal and sagittal reconstructions we can see through. So, sorry, I didn't notice the volume there. This is the patient. This is about between the 2 and 4 week period. The therapist was able to take a video and send it to us, but he was weight bearing immediately after surgery, albeit slowly, but was able to put weight on it with very little pain. And then at the 6-week visit, he's able to ambulate 100 feet with the therapist and is very comfortable. He's just still a little deconditioned from his time being down. But these are the radiographs from his 6-week visit that show no real change in the implant position and no real change in his resting deformity and some signs of interval healing. Thank you.